Hey, it's the nursing professor, it's Professor Jones, and today I wanted to talk about HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. This was enacted back in 1996 and basically came up with a set of national standards that have to be used when dealing with a patient's health information. There goes that PHI. That stands for patient health information. So it's basically safeguarding how we as healthcare providers deal with a patient's health information. That data is sensitive. And so once things became normal that it was on a computer system, they had to come up with a way that we keep it safe. So you as a CNA have to make sure that when you are providing report, when you're giving report to each other at the end of shift or the beginning of shift, that you are being sensitive and that you are making sure that you keep the patient's information safe. So what does that mean? That means asking family members to step out of the room if you're getting ready to discuss anything that could be disclosing of the patient's information that they haven't given permission for. It also means to be careful when you're documenting. Make sure that family members or people just in the hallway cannot see the patient's chart. So most health facilities that I know of have the screen on so that if you're standing to the side or right behind it, you can't see it because it's a privacy screen. So it is your duty to make sure that they're on there and that they're working. And if it's not, that's something you report to your manager to let them know, hey, this screen can be seen by others. And this could be a HIPAA violation. Facilities and hospitals can be fined for not safeguarding a patient's information. So it's very important that that is followed. Furthermore, do not get yourself in trouble. There have been several situations in which different health people, and there's been nurses, there's been radiology technicians and other entities that help us in the health field that have gotten in trouble with accessing people's records that they have no business in. So see, this HIPAA thing also means that you can only access a patient's information that you are taking care of. So you only need to access the knowledge that you need in order to take care of the patient. Just because you work in a facility doesn't mean that you can look at someone else's chart because they're a family member or somebody you know, or somebody's asking you some information. If you are not directly involved in that patient's care and the information you are accessing is not what you need to do your job, you are in violation. Keep your job and keep your patient's information safe. HIPAA.